Today I would like to share our study about diagnostic accuracy of benign vertigo in different specialties. As we know, vertigo can be the primary presentation of stroke, but this stroke is easily misdiagnosed as benign vertigo, especially if the vertigo is not associated with focal neurological signs. According to the previous studies, patients discharged with benign vertigo have higher stroke risk than general population, but we don't know if this higher risk is associated with different medical specialties. So our study is to compare stroke risk among patients discharged with benign vertigo across different medical specialties. Our study is a population-based retrospective study using the National Claim Database of Taiwan. This is a big database including around 1 million people in Taiwan. And we compare the stroke risk of patients diagnosed with benign vertigo by the doctors in neurology, otolaryngology, internal medicine, and family medicine clinics. And then we combine neurology and otolaryngology to be the specialty care group, and combine the internal medicine and family medicine to be the general care group, and compare the stroke risk between these two groups. Okay, this is the study flow chart. Initially, we include all patients diagnosed with first instant vertigo, meaning that first vertigo and seeing the first doctor in the clinics between 2002 and 2009. And then we excluded the patients with dangerous vertigo that their doctor suspected. So we excluded the patients referred to the emergency room and the patients who were admitted on the same day of the index clinic visit. And then we excluded the patients diagnosed with stroke at the index clinic visit. Furtherly, we excluded the patients diagnosed with central type vertigo at the index clinic visit. After we excluded these three groups of what we call dangerous vertigo that their doctor suspected, the residual patients were the benign vertigo patients that their doctor impressed. And then we classify these benign vertigo patients into 5 groups according to where they got the diagnosis: in neurology clinic, otolaryngology, internal medicine, family medicine, or other clinics. But we excluded the last group, other clinics, because most the other clinics mainly contain the pediatrics clinics and Chinese medicine clinics. So this population is largely different from the other 4 populations in these groups. So we excluded it and only compared these 4 groups. And then we combine these 2 groups as the specialty care, and combine these 2 groups as the general care group, and compare stroke risk between each other. Okay, let's see the result. This is what we call the Kaplan-Meier curve, representing the long-term stroke risk among different specialties. As the result, the cumulative stroke risk in patients diagnosed as benign vertigo by their doctors are different in different specialties. Highest in internal medicine, and then family medicine, neurology, and lowest in otolaryngology. So from this curve, we can see that the ENT doctors looks good, but unfortunately, I'm a neurologist. But the different long-term stroke risk across different specialties may be not only related to the different misdiagnosis rates, but also related to the different baseline stroke rates. What is the different baseline stroke rates? Let's see this table. The patients visiting otolaryngology clinics were younger than other groups. And do you find that? The patients visiting internal medicine group had more hypertension and more diabetes than other groups. So, the population